One thing I'm going to throw these all together is physician drug and alcohol abuse and physician suicides. And I know part of your lawsuit focuses on physician suicides. So just maybe give us a little insight to that.
Yeah, in America, every year there are approximately 400 physicians that commit suicide, and a large percentage of these suicides are related to medical board or a consequence of medical board corruption and the suspensions and revocations that come from that corruption. So this point of this epidemic physician suicides is a point that I've raised in the Kaul cases, and is a point that I've argued calls for this urgent reformation of these medical boards. Every year there's 400 doctors committing suicide. Now, as far as I'm aware, there aren't 400 lawyers committing suicide. There aren't 400 insurance executives committing suicide. So there's a disproportionate number of doctors committing suicide. And again, it goes to the point that we were discussing earlier about the need for the profession to take back control so that this epidemic can be stemmed. And just to go generally to the issue of suicide, suicide occurs for the most part when individuals feel as if there's nothing that they can do or nothing that can be done to rectify their situation. And that's a terrible indictment of this system that exists in America. Now, the American medical profession, if you compare it to the rest of the world, the rate of physician suicide is about 10 to 15 times higher than in other westernized democracies. And that's no coincidence. It's a consequence of fundamentally medical board corruption. So by eliminating this corruption, by bringing about this reformation, it's going to save the lives of many doctors going forward. And not just the doctors, Eric. People have to understand about the impact that these kinds of events have on the doctors' wives, their partners, and their children. I mean, this is a generational injury.
And their patients.
Sorry, what did you say?
And their patients.
Yeah, and their patients, of
the
course.
The sudden loss of a physician, and they have to find somebody else. And let's say the physician's license was revoked because the medical board didn't find the way that they prescribed opiates to be appropriate. That may well be correct. But to just remove that physician suddenly from a patient's life, that's very traumatic to a patient. If you're on opiates as a patient and you try to find a new physician, it's almost impossible. They don't want to take you on because you've become a liability.
But the problem, you see, is that most patients, again, they either feel as if they can't do anything or they don't. I mean, they're sick, they're patients. So this fight that, we are involved in, I mean, this is a fight that, as I said, it's going to be won through the law courts, and it's going to be won by bringing to the public's attention, this particular point of all these doctors taking their own lives. And the more that physicians talk about it, the more likely it is that there's going to be change. And just as a quick point here, over the last few years, I've spoken to many people in this country and around the world about this problem of medical board corruption. And many people have said to me, we've heard nothing about this. We've read nothing about it. How come? And they said, how come more doctors aren't coming out and publicly speaking about this problem? And I said, because they're scared. They're petrified of what will happen to them if they come out and publicly speak. And in talking to one particular individual, I said, it's no different to the system of oppression that existed under the Nazis. When the Nazis were taking over Europe and oppressing other peoples, anybody that dared to speak out was dealt with swiftly. And it's the same system of oppression that's existed with American doctors vis-a-vis the medical boards. And so by you speaking out, by us doing this show, by bringing these issues into courts of law and the courts of public opinion, we are exposing we're exposing the system, which is always what one has to do before you bring about change.
Yeah, and 2 points on that. First, doctors, well, back, let's say when HIV, AIDS first was discovered, or at least noted, we recognized that if we criminalized that disease or somehow, I don't know, labeled those individuals, that they wouldn't come forward for help, especially individuals that were sick and had not had an AIDS test, and that they would be reluctant to go out and kind of expose themselves to a more public presentation. So the same thing is happening with physicians. Physicians, no doubt about it, lots of stress, a lot of jobs with stress. But in other professions, if someone has a drug or alcohol problem or depression, they go when they get help, and they have insurance that covers that. And in certain venues, like in, let's say, celebrities, it's actually celebrated when they come forth. But if a physician has a drug or alcohol problem, or they have depression, I mean, they've discovered, or they've realized through what they see happen to their colleagues, that they need to keep this undercover and keep quiet. And in one woman I know in particular, she has bipolar disease. It's very well controlled. She's a great doctor. She's an emergency room physician. Yet she had a manic episode on 2 different occasions because she was on prednisone for her asthma. Now, she alerted the medical board and took herself out of practice for the period of time that she was using the prednisone. But the medical board attacked her, and they put her into a physician health care program, which is typically for people with drug and alcohol problems. And for years, for 10 years, she's been tested on a routine basis for alcohol and drugs, never tested positive. She has to call in daily to report that she's, not up to something nefarious. And this is the kind of pressures, when other doctors see it, they're going to go into hiding. They're not going to go and get help. And that is detrimental to them, their family, and their patients, i.e. the community. So I'm very concerned about that, because instead of helping doctors and their colleagues recognizing the stresses and the difficulties that they themselves deal with, they attack others that are having those problems and somehow feel good about themselves at the end of the day, having done that to one of their colleagues. It's very vicious. So one of the other things you speak about is the number of physicians in jail at this time. Could you go into that a little bit further?
Yeah, at this point in time, there are a greater percentage of the American medical profession are in jail than has ever existed in American history. And again, this mass incarceration of doctors is a consequence of the insurance companies wanting to basically reduce the number of physicians in the marketplace, but specifically going after doctors to whom they owe money. So what's been going on is that if a doctor has built a successful practice and the insurance companies owe him or her a substantial amount of money, what the insurance companies do and have been doing is instead of paying the doctor, which is what the law demands, they go to the state and federal regulatory authorities and the medical boards, and they tell them to manufacture a false case against the doctor to take away his or her license, to take away his or her liberty, and then the insurance companies will use those false convictions, those false revocations or suspensions, they will use those as an excuse to not pay the doctor. So again, this is a scheme, an illegal scheme. It's racketeering in its purest form that these insurance companies have engaged in purely for the purposes of executive and shareholder profit. And they've been doing it at the expense of the lives of these doctors.
Well, this is what happens when you take healthcare and put it onto the stock market. Then it's all about money. It's not about taking care of the public. It's all about shareholders and executives, as you said. So would you say that this is a result of the medical schools and residency programs doing a poor job of choosing and training students and residents? Because some people are going to ask that.
No, I think that you would have to then assume, if one were to take that position, that American medical schools are somehow incompetent at turning out physicians, or they're picking the wrong people. But that's not the case at all. The reason that there are so many doctors who are wrongly in jail and doctors who have been victims of illegal suspensions and license revocations, the reason is medical board corruption. That's the reason. And it goes back to the point that we talked about earlier, is that these healthcare corporations have corrupted medical boards, and that's why you've got all these doctors in jail. That's why you have all these doctors without a medical license. It's as simple as that.
So one of the things we or at least I mentioned it earlier, is the Healthcare Quality Information Act of 1986 that was brought about by then Representative Ron Wyden, who is now Senator Ron Wyden. It's basically the result of a court case by the name of Patrick v. Burgett, Burget, that was finally decided by the U.S. Supreme Court in 1988. And Ron Wyden has been, I've spoken to his office on numerous occasions, sent all kinds of information about what's occurring as a result of this act. And in fact, I spoke with Ron Wyden personally at one of his town hall meetings. He said he'd never heard of, and this is just a year ago, he said he'd never heard of any problems as a result of that act. Yet, no one within his office has gotten back to me, has made any mention of the information that I have sent them. So, again, maybe you could just say a few words about that, the HICWA, as they call it, of 1986.
No, before I comment on that, I'd like to say that this senator in Oregon is lying. He knows the effect that this law has had on the profession, and I wouldn't be surprised if he's been paid off by the insurance companies and these healthcare corporations. So politicians in America, they lie, they engage in bribery, and I'm sure if this senator's financial records were to be subpoenaed and he were to be deposed, I'm pretty sure that this evidence would come out in the Wyden wash.
Well, you can go to online websites that are fairly detailed in regards to politicians, and we're talking down to your state senator, your mayor, etc., that they catalog and document who they're receiving campaign donations from. And there's no doubt Ron Wyden receives incredible amounts of money from insurance companies and other healthcare entities. One of them being Centene, Centene, who is a big time player as a coordinated care organization, basically administering the Affordable Care Act, to the point where their CEO is making, like, last I saw, $22 million in 1 year. The average person in this country makes about $50,000 a year. He's making $100,000 a day, and that's if he works 5 days a week for 52 weeks. So yeah, go ahead. I'll let you finish up about HICWA.
Yeah, so this is a piece of law that went into effect in 1986, and it's emblematic of the overregulation of American healthcare. There are too many laws, state and federal, within the American healthcare sector, and they've done nothing to improve health in America. And we can see that now with the excessive mortality associated with COVID-19. But what they have done, and what they were intended to do, is put money in the pockets of unscrupulous politicians like Wyden and lawyers. So again, the over-regulation of American healthcare is a symptom of the corruption. And so you have to get to the root cause of the corruption to eradicate it. And if you get to these corporations, these insurance companies, these healthcare corporations, and these pharmaceutical companies, if you get to them, then you are going to begin to dismantle this network of corruption. So characters like Wyden, like Christie, like Schumer, they are puppets. They're the puppets of these corporations. So you have to get to the puppet masters. And that's what I am pushing for in these lawsuits, and with the book and the documentary and the public speaking, is to expose it so that the world can see the show. It's like in The Wizard of Oz, pulling back the curtain. That's exactly what we're doing, is pulling back the curtain.
Right. And just a couple of words about the Patrick v. Burgett Supreme Court decision. Dr. Timothy Patrick was a surgeon in Astoria, Oregon, and he decided not to join the Astoria Clinic after being there for a year, and he went out on his own. And that immediately resulted in an attack on him from the hospital executive committee, where one of the Astoria Clinic physicians was a member of, and then also at the Oregon Medical Board, where another of the Astoria Clinic physicians was on the medical board. So this is the kind of attacks that are occurring with physicians. They are being attacked by entities for different reasons, as we've discussed previously, to remove physicians that they no longer want to have as competition. So the other thing I want you to kind of, and I guess this is kind of a progression. The Healthcare Quality Information Act, again, has been in effect since 1986, and it's been used as a very big stick to beat down doctors and really any licensee and give the boards absolute immunity. But then it came along another Supreme Court decision in 2015. It's the North Carolina Dental Board of Examiners versus the Federal Trade Commission. The Federal Trade Commission got involved at the state level in North Carolina because dental whiteners were being attacked by dentists and being told they couldn't do it, only dentists could. So, as I said, at the administrative level in the state, the North Carolina Dental Board lost. But then they started taking this to federal court. They went to the district court and lost against the FTC. The appeals court, they lost against the FTC. And then finally to the Supreme Court, where they also lost against the FTC. And one of the most important things that comes out of that decision, and they based a lot of their decisions upon the Timothy Patrick v. Burgett case. But another case they rely upon heavily is a case called the California Liquor Dealers v. Mid-Cal Aluminum 1980 Supreme Court case. And from that come the Mid-Cal rules. And the North Carolina Dental Board decision specifically hammers on these rules as to how important they are. And the first rule is that legislatively within a state, it has to be clearly articulated by that state as to why they are being anti-competitive in that specific arena. The other thing is the most important, and they say that the first rule cannot stand on its own. It has to be backed up by rule number 2, which is that there has to be specific oversight that's clearly outlined by the Supreme Court and the Mid-Cal decision as to how these boards have to have oversight. So just a little bit more of your feelings about this decision and how it plays into this entire picture.
Well, I think that the body of law regarding the oversight of medical boards, regulatory boards, and how they operate is consistent with what we've talked about. The issue is the enforcement. So, the FTC case mandated that medical boards have to organize themselves in accordance with the Constitution and have independent oversight if they have, quote, market competitors on the board. As far as I'm aware, and I laid this out in a series of admission statements in these cases that I'm prosecuting, no medical boards in America have brought themselves into compliance with this particular body of law. And this now is fact in these cases that I'm prosecuting. So the Supreme Court is knowledgeable about this issue, but with any court, it can't do anything unless a party brings a case to its doorstep, which is what I'm doing. I'm bringing these cases to its doorstep, and I'm saying, here are these cases, this is the law, you must now compel these medical boards under penalty of contempt to follow the law. And the Supreme Court can do that. It can enter orders whereby if these medical boards do not become compliant with the law, that they will be penalized financially, monetarily, and that the members themselves will have no immunity. They have no immunity. So the members can go to jail if they're held in contempt of court. So ideally, you want these people to comply, but if they don't comply, they will end up in jail. That's where these medical board members will go. And that's the way that I'm prosecuting these cases, is it's not just I'm asking for money, I'm asking for a public apology, but I'm saying that I will pursue these cases till these individuals are in jail. And I think that when you've got hardened criminals, the only thing they understand is sitting in a jail cell. And it's the same thing with many of these medical board members. They're hardened criminals. And that's where they need to be, is in a jail cell. And once you've got some of these characters in jail, I'm telling you, the rest of them will not want to go down that road. So you've got to spank a few of them hard. And that's what's going to happen.
Yeah, and you're using this decision very heavily in your case. It's what they gave us, the Supreme Court, is a tool. And we have to take that tool and utilize it. And you're the first person to do this. I'm going to be the second person. I've already been in federal court, but that was back in 2013, 2014, prior to this decision. And as you said, these individuals have no immunity as per that Supreme Court decision. They're nothing more than a private trade association. Excuse me, I get a lot of feedback with these headphones. A private trade association that has no immunity and no protection from the state. And the other problem is that these judges, whether they be at the state or federal level, they have they're playing games. They're in cahoots with people within the public. So an example would be here again in Oregon, where federal district judges are friends. The one that oversaw my case, Judge Anna Brown at the Portland District Court, she gave an award to Kathleen Haley's husband, Kathleen Haley being the executive director of the medical board at that time. So that's another concern, is getting past these criminal judges and getting it into a venue where you can actually get an honest player. You may need to take it out of your state or maybe completely out of the district if you can show that there is corruption within those courts that will adversely affect your decision in your case. So the other thing is, we spoke about it earlier, is the Federation of State Medical Boards. And I want you to speak to that a little bit more, in particular, their 501c6 nonprofit status.
I think the point that you're trying to get to is that the Federation has set itself up as a charitable organization, and it's not. It's a for-profit organization. So it's done that to again give this facade that it's furthering some public interest, which it's not, and to facilitate its tax status. But the Federation, very simply, is again a corporation. It's not a state agency that's in the business of healthcare, and it makes millions of dollars at the expense of doctors. And again, I want to bring it back to the solution, because I think it's important that we talk about the solutions to all of this, because anybody listening to this around the world will think, oh my God, that sounds like a horrific situation. There's no way out. And I don't want people to think that. I want people to see that there is a way out, and that way is being forged, and that there will be change. So as bad as it has been, it's not going to be that way. It's going to change. And again, I come back to the fact that it's been allowed to persist in that way because most doctors in America don't know the law. And when they've found themselves in these situations with medical boards, they've had to go to a lawyer. And there comes a point in time where they run out of money and they can't afford a lawyer. And that is what has turned their fight off. And medical boards and the lawyers on them have exploited this fact over the decades. But I would say in my case that in learning the law, I took that equation and turned it on its head. And so I haven't had to pay a lawyer. I've been prosecuting these cases myself. And from 2016 onwards, the more that I practiced the law, which is what I was doing, the better I got at it. So I'm at a point now where I'm about to file a writ of mandamus in the United States Supreme Court with regards to one of the federal cases. And if the Supreme Court grants this writ, it's going to have a major impact on these cases in the sense of bringing them closer to victory for me. And if that happens, then that's going to be a major step towards this reformation of American medical boards. And so all the problems that we've been talking about, the solution to these problems is going to be that much closer on the horizon. So as I said, people listening to this, I want them to, to say, well, there have been these problems, but now there are these doctors like yourself and me and other physicians who have taken the bull by its horns and are now beginning to bring about this change.
And I think it's worth noting that the head of the Federation of State Medical Boards, Dr. Chowdhury, is making $850,000 per year as the head of a nonprofit. There's others also within that institution, that nonprofit, that are making hundreds of thousands of dollars. The 501c6 status means that they can take donations, what I call bribes, from we don't even know who. All we know is that we don't even know the specific singular amounts. All we can see as the public is an aggregate amount. And we don't know who it came from, when it came from, or the amount that it was. So it's completely hidden. And as a 501c6, basically all you do is lobby. So what they're doing is taking in bribes and lobbying for these individuals. Now, if they contribute to a campaign, a political campaign, or a political cause, then they'll pay taxes on that amount of money that was given. But otherwise, they don't pay any taxes for that bribery money, nothing. And they go along and do the bidding of whoever their bribers are. And again, that comes back to Purdue Pharmaceuticals with OxyContin. They gave hundreds of thousands of dollars to the Federation, and the Federation pushed opiates until there was pushback from the government, from people like Senator Grassley, and asking questions. There was a Senate hearing. Unfortunately, all those records have been sealed by the senator that was from Utah at the time. I can't think of his name off the top of my head.
Warren Hatch?
What's that?
Warren Hatch?
Yes, Orrin Hatch. That's who it was. He sealed the records. And believe me, Ron Wyden was involved with that also. But again, we've got a nonprofit that's lobbying as a result of bribery. So, and one other thing I wanted to mention, I brought up Louisiana State. I don't want to say anything more about it, except that the senator's name was John Milkovich, Milkovich. And again, it was Senate Bill 286 in 2017 and Senate Bill 187 in 2018 that were nothing more than a bill for physician due process. Incredible. So, Dr. Kaul, I know we're getting kind of short on time. What do you tell individuals that are thinking about going into medicine at this time?
Well, I would very simply say that they need to make themselves aware of the issues that we've been talking about. And if they feel comfortable after having made themselves aware that they want to proceed into a career in medicine, then they should do that. But I think the important thing is to educate medical students as to the realities of the practice of medicine in America today. Going to medical school and spending time in classrooms and cadaver labs, you're living in a bubble. Once you step outside of that bubble and you go into the practice, and you have to deal with the cut and thrust of medicine in America, it's a very different world. So I think it's important for medical students to recognize the risks associated with practicing medicine, the increased risk of suicide, the increased risk of going to jail, and the increased risk of losing your livelihood. So, if you've committed 10, 20, 30 years of education and training to then have it removed illegally by a corrupt medical board and corrupt state and regulatory federal agencies, it's a life-ending event. And so, again, it's just about recognizing the risks. It's like a person who goes bungee jumping. They have to sign a disclaimer at the beginning, and the person says, well, you could die. And so they accept that risk. So in a way, medical schools should be giving a disclaimer to medical students saying, these are the risks. Just like when you have a patient and you have them sign a consent form, and you say these are the risks of the procedure. So medical students really should be given a consent form and told about the risks. And I think, again, with the public, when I begin my public speaking, I mean, there are many things that I'm going to be covering in regards to the healthcare sector, and that is going to be one of the points, is talking to medical students about these risks.
Yeah, it's a huge risk, and you are not really told anything about it. And it's a risk across the board. Anyone can make a complaint against the physician. Anybody, your next door neighbor, a lady that thinks you're yanking on your dog a little too much while you're walking it, spouses, family members, friends, certainly hospitals, insurance companies, medical boards, etc. And typically, by the time a physician loses his license, it's really a decision that's made by 4 to maybe 6 individuals. And at that point, once you lose your license, there's really no way to get it back. It's very difficult unless you go through a fairly arduous fight like you've done. And I know you've been able to recoup a license in another state, but that doesn't remove the black mark that's next to your name. You still are going to have problems with contracting with insurance companies. You won't be able to get into a hospital and get hospital rights, all because of a decision that was made in New Jersey. Whether another state gave you a license or not, it really doesn't matter, because, again, that black mark is still there. So I describe it as a minefield. Every day you're walking through a minefield and you don't know where that mine is at. And if you happen to step in the wrong spot, yeah, you lose everything. Everything you've ever worked for is gone. And it affects you not just across the entire United States, but now it's in the Western world, and it's actually morphing outside that to even countries like Ghana, African countries, where you won't even be able to go to another country, no matter where it's at in the world, and get a physician license.
Right. Yeah, I mean, listen, I think that for myself personally, and I think this comes from my childhood and my experiences growing up, and I talk about this in the book, I always, see adversity and advantage kind of connected and one and the same. And so these things that have happened to me over the last 8 years, in many ways, I wouldn't be where I am today, which is a great place from a legal standpoint. And, from a public relations standpoint, is that I don't think that I would be qualified to go out and start publicly speaking if I hadn't gone through all of the professional challenges that I've gone through in my life. And in the book, I use the analogy of a guy who is on a diving board, and he's walking out towards the edge of the board, and as he walks out, the board starts moving downwards, and it starts to accelerate in a downward direction the further he gets out towards the edge of the board. And once he arrives at the edge of the board, he realizes that if he just holds on tightly with his toes and maintains his balance, that there's going to come a point in time when that board will recoil and he will start to ascend. And that's exactly what's happened in my life, is when these events started in 2012, I knew that there was a reason for these things that were happening. And that point has become increasingly clearer to me from 2016 onwards. And, here we are today in 2020. And, early next week, I'm going to be filing this writ of mandamus in the Supreme Court. So I don't think that if these things had not happened, I don't think I would be where I am today in terms of knowledge of the law, in terms of changing a system of oppression And I feel that individuals who've gone through this, what I would say to these individuals is it's easy to get dragged down by the trauma of what happens to a person's life. But I would say that what physicians should do is change their perspective on these events and look at these ostensible losses actually as gains.
So what are you advising physicians who have run afoul of the medical boards at this time?
Well, I think that the first thing that is they should try and connect with groups or other physicians who have gone through the same thing. I think that there's strength in numbers. I think that they should be very careful of the lawyers that they've got working for them. And I think that they should fight and be prepared that it's going to be a long fight. So many physicians, when things like this happen, they can't see any future. And so they get sucked into this vortex. But a physician has to stop him or herself going down in that vortex, and they have to think, with a wider perspective. They have to, develop a kind of a spiritual basis to their existence. They have to become, in many ways, not attached to the things that are happening. And in doing that, and again, I talk about this in a book, and I refer to the book because it creates strength in a physician's mind and an ability to fight the injustices of these corrupt medical boards. So it's difficult. A lot of doctors who have these things happen to them, for many of them, they've never had any hardship in their life. This is the first time that something as traumatic as this happens to them. But what I would say to these doctors is don't give up and fight and look forward in terms of what you're going to actually do to change your situation.
I agree. Again, speaking to the North Carolina Dental Board decision of 2015, a tool was given, and physicians need to find lawyers that are willing to use that tool if they're going to go the route of being their, using a lawyer, as opposed to someone like yourself that went pro se, representing yourself. It's a very difficult situation for these folks. And what I've been advising is to get very offensive. What most of the lawyers advise their clients dealing with the boards is to not fight, to just bend to whatever the medical board tells you to do, whether it be right, wrong, indifferent, good or bad. And these lawyers, as you said, they'll work with you until you lose your money, you run out of money, then you lose them as representation, and you're on your own. And next thing I know, people are losing their houses, they're running up credit card bills to be able to pay these lawyers, and it just causes more depression and resultant destitution. So again, what I've advised is for people to avoid the hearing altogether and get offensive, use the North Carolina Dental Board to their benefit, and to start hammering these people because they have no right to be making these decisions as private actors. They are not part of a board. They are not under government control. They are nothing but a private trade association, and they can be sued in their person. And they are not allowed to use the State Department of Justice to represent them. They have to get their own lawyers. And you have to be persistent. Whether it be your lawyer or yourself that's representing you, you have to be persistent in these tools that have been given to you.
Yeah, I agree.
So we're going to end it here, Dr. Kaul. First, I just want to let people know that Dr. Kaul is a hero to me. What he's doing The reasons why he's doing it, as we've discussed earlier, are, again, beyond himself. He's heroic in the way he's approaching this and the reasons why he's doing it and what his end results are hopefully going to be. So I want to applaud him on that alone. He is a pioneer. And again, I don't know who came up with this saying, all I do is remember it, that you can always tell who the real pioneers are because they have the most arrows in their back. And Dr. Kaul is a hero. He takes the arrows and uses them to his advantage. Now, on this video and on the websites that I place it, and where Dr. Kaul places it, I'm sure, there's going to be links for his books, other interviews. There's a great interview of him just about his book that will be linked. And there'll be some other things that'll be also linked or added. But one thing I want to, I know there's already one date that's set up for I guess it's a motivational speaking. That's sometime in November, I think you said?
Yes, correct, in November, Eric, yeah. And the title of the series of talks is Adversity into Advantage. And very simply, it's about me using my life and the lessons that life has brought to me to help other people understand how they can take their own adversities and turn them into their advantages.
And when is that in November, and where's it at?
November 15th it's starting, and the first one is in New Jersey.
Where at New Jersey?
Oh, it's in northern New Jersey. I'll be putting the details out shortly.
Oh, okay. And I know you have some 2 or 3 other ones that are scheduled or somewhat scheduled for next year. Any specifics on those, or again, wait until those are available?
Yeah, the date for the first one in 2021 is going to be March, and the exact location has yet to be confirmed, but it's going to be the second week of March.
And when you say location, do you know a region or you don't know?
No, it's going to be the West Coast. It's going to be in California.
I think you said maybe Sacramento. Was that? Do I remember correctly?
Yeah, we're deciding between Northern California and Los Angeles. Probably going to go with Northern California because it's just the traffic around LA is terrible.
Yeah, and I think being more centrally located, more folks will be likely to attend. Yeah. As opposed to, like myself, I'm going to come down and see you from Oregon. It's going to be a lot easier for me to get to Sacramento than it is to get to Los Angeles.
Yeah.
Yeah. Well, very good. Any other things you want to add before you go, Dr. Kaul?
No, I'd like to thank you, Eric, for the interview and for allowing me to speak and to give my opinion on the solutions to the problems that we've discussed.
And I want to thank you, Dr. Kaul, for coming on and exposing yourself, because that's really what you're doing. You're exposing yourself bare to the world as to what's happened to you, what you're doing about it, and what you hope the future outcome is for others. And again, I applaud you for your pioneering work. And I do want to apologize to whoever's listening to this video, this interview. On my side, I have these speakers on, these headphones on, and I get a delayed effect, and it kind of interferes with my ability to narrate to some degree. So I apologize about that. But otherwise, thank you very much, Dr. Kaul. Excellent interview, excellent points, and I'm sure we'll be speaking again.
Good. Thank you very much, Eric. Thank you.
You're welcome. Bye-bye.
Okay. Bye-bye.